Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxy, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Welcome back to the show, COIQ listeners. On today's episode, I have Emrah Gultekin with me, who is the CEO for Chooch AI. Welcome to the show.
Thank you. Thank you very much, Dr. Roxy. I really appreciate being on the show.
So, we were just talking a little bit how our show has shifted the conversation quite a bit in the context of COVID-19. And so we're, still being true to our mission and our purpose of helping health innovators talk about business strategies and commercialization strategies so they can get their innovations in the hands of the people that need them the most, which is really not no more important today than it was, 30 days ago. But, most of the conversation is shifting just a little bit where we're talking more about pivoting and change and what's kind of happening in the thrust of this crisis that we're in. So before we jump into those details, just tell our listeners a little bit about who you are and what type of innovation or work you're doing.
Sure, great. We're definitely living in unprecedented times. And as Chooch AI, what we're doing is we clone human visual intelligence into machines so that the machines can do what humans do at scale. And so we've been doing that for a while on the cloud. And we recently have been putting a lot of our models on the edge as well. And some of those cases are for healthcare. And so we've been doing a lot in healthcare recently before in this crisis. So we've been basically able to clone those experts' vision into machines so that they can count cells or they can know what's happening in the operating room, what's going in the surgical cavity, what's coming out, and so forth, so that there's some validation there on what's happening, and plus scaling that out to make diagnoses quicker and faster at scale. So really, focused on that part of AI where it's all visual, where you take the cameras and the any type of visual content and have the machines tag on behalf of the humans. So that's really what our company's about. We're in healthcare, where we're also doing a lot of geospatial. We do a lot of safety and security as well, and also in media and retail. So very horizontal platform that could be applied to many verticals, but healthcare is definitely one of them.
Okay. So I think that's great because you'll kind of give us maybe a little different context in our conversation where you're not just focused on the healthcare industry, but maybe have a broader perspective from as an entrepreneur and innovator, really, like you said, horizontally across all verticals. So thinking about the healthcare industry and what you're doing there, how do you think the COVID crisis is impacting entrepreneurs in healthcare?
Yeah, great question. We're definitely, this is unprecedented, and I don't think we've seen anything like this, not even 9/11. But what's negative and what's positive about this, if we put it into two different buckets, maybe talk about the negative a bit. The negative impact is what we're seeing in our sphere is the closure of basically funding this period from VCs and PE companies, even for healthcare entrepreneurs. It's a time of uncertainty. Yeah. And when VCs and investors get really scared. So we're seeing that as an issue, as a negative impact. And that's one of the negatives. But we should focus on some of the positives. The positives out of this is that we see how behind we are in tackling these issues. Whether it's a pandemic or it's another type of emergency, we see how unprepared we are for this. So that means opportunity for entrepreneurs. So whenever there's a crisis, it's actually accelerating some innovation. And we see that in previous crises as well, like the 2008 crisis, the financial crisis, and also .com, and previously before that, all these crises. So what we're seeing as a company is sort of the acceleration of the impact of AI into these different industries, and healthcare is one of them. So if we take it from a human to human interaction, so that's kind of the classical interaction between people to actually come to some sort of understanding or some sort of decision, we're seeing a move towards human to machine interaction, because people are afraid to interaction. We're seeing that schooling and education. We're going to see in healthcare more, and we're seeing it across different verticals. And so that's going to accelerate the adoption of AI. And you've seen a lot of these negative things about AI over the past, let's say, 5-6 years. I think all of those, or most of those, would go away as we see the positive impacts of AI. So if we had AI today, we wouldn't be stuck in our homes probably, because we would know exactly what is happening to each person. And that doesn't mean mass surveillance. It just means sort of like transparency of what's going on.
Yeah.
And to be able to test quickly, to be able to trace quickly, to be able to mitigate quickly as well. So if we know more about our communities and what's happening for each person, in each person, we're able to live our lives, in a normal sense, instead of like locking everyone down. One of the issues is currently testing. Testing is a problem, and we know from China and some of the Asian countries is that people have testing kits at home, and we don't. And so people get tested. They test themselves maybe every week to see okay, and then they go outside. If they're sick, they stay home and so live their normal. So we're seeing this. We're going to see this shift in the West as well for these types of things. I think for entrepreneurs, it's really important to focus on some of these problems and solve some of these problems right now. And this is not it's not going to happen overnight. It's going to take years for us to develop these capabilities. But definitely that's one of the positive impacts I think we're seeing out of this crisis. It's still early. I mean, it's still very early in this crisis. We don't know how long it's going to last and what impacts it'll have on the economy and whatnot. But in terms of accelerating the adoption of AI and some of these automation tools, I think we're going to see that accelerate very, very quickly.
Yeah, and I think, based upon the context of this show and what we talk about here is that is, I think, like the greatest silver lining in this terrible situation that we're facing, is that I think COVID-19 is going to be a catalyst for significantly increased adoption, really across, AI as well as a lot of connected health and digital health and remote monitoring. I think that that human to machine connection, like you just described, is something that, a lot of the population, whether it's B2B or B2C, have been opposed to or resistant to for a long time. And we're all just, as a society as a whole, being thrust into this, kind of whether we like it or not. And I think that a lot of people will find out that they like it. Like, oh, wow, I don't know why I was so resistant to this for so long.
Right. I think the resistance is kind of like it's more a habit rather than pushing it away. But this is all about efficiency at the end of the day, right? I mean, we're trying to be more efficient at what we do, and human to human interaction is very, very important. It's important for our minds, our characters, our well-being. But if you're creating, if you're trying to do things quickly and at mass, you need the machines to help you. And
Yeah.
it's just, and we can do it. We have the capability to do that today. With all the cloud services and the cloud. Remember, the cloud services kind of expanded after 2008 crisis. I mean, it was have the cloud before then, and so now that we have this base of the cloud, it appears as though it's time for AI to come to the picture too.
Center stage, right?
Yeah, it's the next stage of this, and this is across verticals. So healthcare is definitely one of them, and I think that one of the issues with healthcare is it's heavily regulated, and that regulation creates some time for things to be adopted quicker than other verticals. But then you have a crisis like this, and you're like, okay, well, who cares? Like, we have to get this done.
Yeah.
And you're seeing this now.
Yeah. Yeah, we are. We're seeing a lot of that. Can you think of some examples?
Well, some examples, and I don't want to get too controversial here, but was with the treatment drug, the malaria drug, and just okay, it's not a vaccine. Let people use it.
Right.
If it's working and if there are no real side effects. We're not healthcare professionals. We're not doctors, so I don't want to talk too much about that. But it's just common sense in a time of crisis, you do what you need to do with what you have at hand, and reduce the red tape.
Yeah. Well, and I think that that's a really important, topic for us to talk about as well. Just a few weeks ago, a lot of red tape came down for telehealth. A lot of legislation and regulatory obstacles were just completely removed overnight for this kind of like groundbreaking, history-breaking moment. And it wasn't one of those things where we had to worry about people's safety. Or even like the efficacy of telehealth. Right. It really, all of that stuff was already there. And so that I think that's an example of what you're describing here. So let's talk about where you are in the innovation process, just so we can kind of set the stage, through the lens of healthcare. Obviously it's not just an idea. So where are you in that? You've launched. How long have you launched? What does that look like?
Yeah, so we launched our product to the public. We made our dashboard and our AI public. It was last March to 2019.
Yep. And
we did our first healthcare project in September, and that was a combination of cell counting, so detecting cells in microscopy and identifying the type of cell. And that's crucial because machines do that, but everyone doesn't have a machine, and they need to be sent to these machines. And what we're doing is we're processing on the cloud and on the microscope itself. So being able to do that real time, live, was very important for biomedical researchers. So we did that for a biomedical research company in San Diego, and we also did a operating room action detection. So being able to understand what's happening in the surgical theater. So when does the surgeon come in? When does the patient? And when is the patient anesthetized? What goes into the surgical cavity? What comes out of the surgical cavity? When does the operation stop? All that kind of stuff we were able to do on our AI. And this are 2 cameras in the operating theater looking at the one's overhead, and it's looking right at the surgical area, and the other is looking in general to what's happening in the operating room. And what it's doing is it's collecting information. So it's saying, okay, this is when anesthesia started. This is when it stopped. This is when the surgical area was uncovered. What goes into the surgical cavity, what comes out of the surgical cavity, the gauzes, and so forth, forceps, all kinds of stuff going on there. And it logs all of those actions in the database. And then what happens is it sends an alert to the people in the operating room if there are any anomalies going on. So if anesthesia was supposed to stop in 45 seconds and it lasted 60 seconds, it'll send such an alert to the people there and say, hey, you need to, there's something going on here. And it's also to share best practices. So let's say a certain surgical team is doing really, really well, and you want to know why they're doing so well.
Yep. And
so you would share that best practice with other surgical teams as well, because it might be the stroke of the surgeon. It might be like, oh, you started this at this time, and so that's the type of stuff we're doing in healthcare. And recently, we just trained public data sets for COVID-19, and we made that public. So lung X-rays, we're able to detect lung injury very instantly, lungs, and that we made public, and we gave basically free to the medical world. And we also waived all licensing fees for medical researchers on our platform recently for COVID-19, which means they can train models very quickly and deploy them with the content that they have. And what does that do? It helps, let's say you're one person looking at radiology, and now you can proliferate yourself and say you're a million people looking at the same thing to quickly classify and identify issues. You don't do diagnosis, so the AI won't do a diagnosis. They'll just say, hey, this is in this category. It might be a lung injury, it might be pneumonia, it might be something else. But then you can classify them and make sure that the people who need urgent care are taken care of very quickly. So these are the types of care.
So let's kind of just pause and talk about that for a minute. Being able to pivot your product strategy and reframe it in a way that solves a problem that we have in healthcare that we didn't have 30 days ago. What was that like? Help us understand, when did you have, what was it like? When did you have this eureka moment? Like, oh my goodness, I think we have an opportunity here. Here's the need. Here's how we could solve it. Here's how we could adapt our solution to contribute to this healthcare issue that we're all facing.
Right. Yeah. So we took a strategic decision at the beginning of the company to make sure that our AI was horizontal enough so that it could be used in different fields.
Yeah.
It was a strategic decision we made, despite a lot of people telling us to focus just on one area. And we did that on purpose because we're unsure about the future.
Right.
Not just the markets, but also like just socially and like also the company. You don't want to put everything into one basket. And so we did that initially. And what happened was when the COVID thing struck, we had some healthcare use cases. And since we're able to use any type of imagery to do visual AI, it didn't matter if it was radiology or infrared or even synthetic aperture radar. It doesn't really matter. You're able to train the AI to understand what's happening in those images instantly. So we said, hey, this is, we were thinking of doing radiology, but, this is an opportunity for us to actually train the AI on radiology. And so we look for public data sets, and people have been working on pneumonia and years now. But training an AI is very, very special. You need to have the system there in place. So we had the system there. We took publicly available data sets. One was from Kaggle, and another one was also a publicly available one. We took those data sets, which were like 6,000 images of the lung X-rays that were already labeled as pneumonia or not pneumonia, and we put that into the system, and we trained our AI to recognize that, and it happened instantly. And then we said, hey, it's working, and we also tested it with our medical colleagues, and it was working to a certain degree. And so we made it public to people. I mean, it was and it was over a weekend before the lockdown. I got a call. I got a call from my CTO, and he said, "Hey, we got to do something here."
So that's, I think the heart of, what I think is most valuable for our listeners is that, we're seeing rapid cycle innovation be, tested, right?
Right.
Even what we thought might have been rapid cycle innovation previously is being tested of like the boundaries of, can we just innovate in a weekend?
Yes. So it was like, my CTO's girlfriend, she was like, "Hey, you guys got to do something here. This is, you got to do something for humanity." It wasn't for the company. It's like, we're fine as a company, but you got to do something. And then CTO said, "Okay, let's look for some public data sets and we'll train them." And it would happen instantly over a weekend. It was one Saturday.
Because you're using AI, so
yes. So why not do it?
Faster?
Yeah. Why not do it? Why not help these people and demonstrate that it's you're able to do it. That we are able to do it. We are able to do it as humans. Mm-hmm. We have the technology here today, and we just need to make sure it's distributed properly. Mm-hmm. And so we did that, and we showed to the world, and we launched the site. I think it was Monday. It's a COVID-19 response, and we've been getting very, very good response from medical people, and it's pretty incredible the speed of how we were able to take those data sets, train them, and then deploy them in the market.
Hey, it's Dr. Roxy here with a quick break from the conversation. Do you want your innovation to succeed, to change lives, to shape the future of healthcare? I want that for every health innovator, which is why I invented COIQ, an evidence-based framework to take your innovation from an idea to startup to full market adoption. If you're not sure where you are in the commercialization process, take the free assessment now at drroxy.com/score. Don't miss out on impacting more lives just because you have a low COIQ score. The free assessment is at drroxy.com/score. That's drroxie.com/SCORE. And now let's jump back into the conversation. So let's kind of go back a little bit. I want to dig deeper into what you're talking about now, but I want to go back a little bit to something that you mentioned earlier around, talking about how is COVID impacting your business. And you talked about, the financial piece. So is in your experience where investors have just completely put the brakes on? Are they looking at opportunities, just through a different lens? Or is it like there's just so much uncertainty, we're not doing anything right now until we wait and see what happens?
So for us, we raised a round in December, mm-hmm. and we're lucky because we're a very lean company, and we're nimble, and we're horizontally integrated into different verticals. So we don't have our eggs in one basket. But having said that, I mean, there is a shift in the way investors think about investing right now, and we're a Silicon Valley company. So
that's why I'm asking you, because you're kind of in the hub, right? So what are you hearing? What's happening?
So what you hear and what's really happening are two different things. So what we're hearing is it's business as usual, but in fact what's happening is there's a shift in the way investors are thinking about these investments and the efficacy of these investments. And I think it's going back to basics of like it needs to be a real business and not just an idea. I think we're seeing that a bit, but I think what's happening in the investment world is people are triaging their current portfolios and making sure that they're healthy. And we have that way, people are making sure that their current companies are going to survive this. And so there's a lot of focus on that today. But new investments, I think people are just trying to understand where this is going to lead. And definitely there are going to be opportunities coming out of this. I just don't think that we know where they are right now, and I don't think the investment community does either. So focus on their current portfolios, make sure that they are surviving and thriving during this period. And then new investments, I don't think, they're probably what we're feeling is that new investments are they're going to take their time to make those decisions now, rather than jump on a train.
Yep. So one of the things that I was reading about recently was that investors were looking for businesses that were COVID proof. And, so those that were able to survive this crisis.
Right.
And what's really interesting is that horizontal strategy that you took, which, doesn't necessarily guarantee a COVID proof business, but it's not a bad strategy to, go, okay, so the travel industry is not working right now, but we've got these other verticals that are like exploding. So let's, make some magic happen here.
That's right. So there are two things, right? And we come from a very hard business background. We were not born and raised in Silicon Valley.
Yep.
We come from another country. We're immigrants, zero generation immigrants to the US. So it's always like, hey, don't put all your eggs in one basket type of thing. And that's why we took a horizontal approach to AI, to visual AI. And we took a lot of, heat for that initially. And that was an issue. We didn't back off from it because we just realized that, this is, if we can count cells in microscopy, you can also count assets from satellite imagery. It's the same thing for us. So why not? Why not say yes? If someone comes along and says, hey, can you do this? Yes, we can. I mean, it's And then the second thing was being lean as a startup is really crucial as well. I mean, being a low burn, having runway to survive these types of things is really crucial as well. So we didn't raise that much money. We had a lean team. We're about 20, only 6 in the US. And then we have 2 in Turkey. We have 1 in London, and we have 11 full-time engineers in India. So we created a lean and global team that could work remotely for us. I mean, we're remote already, so nothing really changed. Right. And our burn is very low compared to our competitors. I'd say our nearest competitor has 5 to 7 times more burn than we do. And so raising a lot of money was, that's a blessing and a curse at the same time. It's a curse when these things happen because you already have like 100 employees or 200 employees, and you need to, triage and make sure that you survive this. And then you're also reliant on those employees to create business, right? Or to create the product, or refine it. Yep. So you can't really do that much with it. So those are the two things. One was keep it horizontal, don't put everything into one basket. And then 2, have a long runway, be very lean and nimble as a team, try and do everything internally. It may take a longer time to do it. It may not be 100% perfect, but if you get to 95% or 90%, it's good enough for people to use. And that's really the strategy we took, and we've been very lucky with that. And I think we kind of lucked out with this crisis because it showed that we could survive, and a lot of our competitors may not be able and may not be in the same position.
Yeah, so let's just talk about that a little bit. From my perspective, it's the ideal, and we kind of have the reality and the ideal. The ideal is an 18 to 24 month runway, so that way you don't have to worry about funding and you can really focus on the business. But that's the ideal. That's not the reality that a lot of the people I talk to live with. What do you think, again, just kind of thinking about our listeners that are in the trenches right now. I mean, is there even, like if you only have 3 months of runway left, what do you do now in the COVID crisis versus, when, you had all these plans to raise money at all these different pitch competitions that were all these conferences that no longer exist, completely dried up overnight. How do you triage that versus somebody that has a much, that, whether they didn't predict this was going to happen, but they just luckily are more prepared with a longer runway.
Yeah. I mean, I don't think nobody knew this was going to happen.
No, if you were doing your SWOT analysis, nobody put like pandemic, global pandemic in the threat section, right?
It's a black swan event, totally black swan event. So no one's prepared for this.
Yeah.
But what we would do was we would do two things, right? And we've done this in the past because we've been in a similar position in terms of not being able to raise money or not having enough traction or, just having some issues. We'd hunker down and focus internally, just decrease our costs as much as possible.
Yep.
Hunker down, focus on the product and the clients that we currently have.
Mm-hmm.
So that's what we do. That's number one. Number two, to reach out to whoever's invested in us in the past and say, hey, we're in this position, and usually what happens is if they're angel investors, they can help. If they're VCs, they can help as well. We had the same situation where we had our investors call us up when this started. They were like, "Hey, are you guys okay? And if you're not okay,
right.
let us know, and we'll help you guys out."
Okay.
So two things: hunker down, focus, decrease costs, hunker down. Go back to your current investors and say, "Hey, we're in this position." Be very open about it. And say, hey, we need, this amount of money by this time, and just be very, very open. Do not hide the problem. The more you hide it, the worse it gets. And people don't appreciate, like, if you're out of money in like 10 days and then you're like, oh, I need money.
Right. Not in any situation.
No, just say, hey, we've got this issue. We're going to run out in 2 months or 3 months. And we need, X amount of money. Be very open about it. Just do an email blast, call people up. If you have investors, if you bootstrapped, it's a different, it's going to be a difficult game. I would just go back to basics. And you can still ping people and pitch. I think people are open to that. You might be surprised as well. I mean, we've had some investors reach out because remember, the investment community still needs to deploy money.
Right, exactly.
Right. They just want to make sure that,
So when they're reaching out to you, Emrah, are they reaching out to you because they, kind of know you already, know that you are vertically, horizontally focused, or did they get wind that you have some type of COVID solution, so it makes it a little bit more, not necessarily certain, but maybe a little bit more viable for them?
They a lot of these people, they've known us from the past. So we've reached out. So I was on a panel the other day and it was about fundraising.
Yeah.
And they asked, like, how long did it take you to raise your first round? And it was like, it took us 2 years. And
that's encouraging.
Yeah. And that was when the economy was booming. And they're like, how many investors did you talk to? Well, over 300.
Yeah.
Over 300 investors. So a lot of these people already know us to some degree, and they're reaching back out, and like we're picking them and like keeping our relationships up, and that's really key as well to have to be able to do that. But having COVID proof, as you mentioned, is important, but we don't know what that is really.
Right.
Yet. I mean, it could be airlines are down, but like restaurants are down too. And so it might be utilities are down in a month because, or something else. So we don't know where this is going to go. It could
How
be.
will we Zoom if the utilities are down? But I guess anything is possible, right?
Yeah. Well, we know that the cloud companies are up.
Yeah, right, exactly. New stock is up.
Yeah. Cloud streaming, these are
Yeah,
up.
yeah.
So it's too late. It's too late.
Yeah.
I mean, it's too late to do something for COVID if you want to pivot. What we need to do is focus on more horizontal products that will be proof to anything in the future going forward. And that's really today's a pandemic, tomorrow it's a financial crisis, next year it might be an earthquake, a wildfire here, whatever. There's always something going on. So you need to have these strategies built out early. If you're focusing on COVID right now, it's probably too late to do that.
So, it's interesting that you say that, because I cannot tell you how many innovators I'm speaking to, like you, where it's not like they were like so early in the innovation process that they just had an idea, but I'm just really surprised at how many are able to pivot and over a weekend, over a week, over 2 weeks, and come up with a solution. And it's not something like, hey, let's figure out how we can just make some more money and sell some stuff. It's, to keep the lights on. It's not that at all. It's more of, like you described, where, there's this new need or this new priority that we weren't on our radar before. And now let's turn this on a dime, and see if we can't really help and solve problems. And it's remarkable the size of the company, how flexible and nimble health innovators are to actually pivot, where it's like, whether it's like a true business pivot, it may not be like their business model completely changed, but there's some pivoting happening. And it's, to me, that's also part of what's exciting right now.
Right. Yeah. I mean, innovation happens in sprints.
Yeah.
And it needs to be pushed. Like, it doesn't happen by itself. I mean, this is not like the universe is an entropy. So if you let it go, it's going to go to, nowhere. So it needs to be triggered by things, and these crises trigger that innovation, and people start to work on them. So these sprints happen. I mean, you see this in the past. Mm-hmm. Historically, it's always been that way as well. I mean, it doesn't happen overnight. What happens during period is innovation in science happens during a that's fairly stable. It happens in pretty much in a linear way, but distribution engineering, that happens in real sprints, and that's what we're seeing today. It's just like, people pivoting, as you say, companies saying, okay, we got to solve this problem, hunker down, do your sprint and make it happen. And people are working like, they've never worked before, like 24/7 right now.
Yeah.
To solve some of these problems, and we haven't really seen that for a long time.
Yeah, it's really incredible, the rallying that's happening. I think that, I don't know if it's because we have so much extra time on our hands. We don't have as many distractions as we had before. Like, there's not as much entertainment, like outside entertainment on the calendar. So I've got some free time. Why don't I just create something? But you're right. There's a lot of that happening where you're just seeing people come together and solve problems in a real deep, committed way.
Yeah. It's focus as well. Mm-hmm. I mean, what's on mind happens on paper. So, when you're focused on something, you're thinking about it all day long, and you have an expertise in your own domain, and you're like, how do I put that together and make something happen? You're focused, and you really genuinely want to do something and help this problem out. And you also want to save your company or make sure that your company thrives during this period instead of failing.
Right.
So
Right.
all that whole combination makes people work very, very hard. It's it's fight for it's you're fighting for your survival.
Survival. Yeah.
Yeah. And that survival instinct creates a lot of strange innovation and sprints that you weren't able to do in years. You can do in weeks.
Mm-hmm.
And I think that's sort of the good that's coming out of this.
Yeah.
Yeah, if we focus on the positive aspects of it, lots of negative. I mean, people are dying, people are getting sick. It's a tragedy. It's a huge tragedy for humanity. But on the other hand, you have people trying to solve it and innovate. And so that I think that's going to make us better in the future and create better externalities for everybody to thrive on.
So the last question that I have for you, Emrah, is we were talking earlier and you mentioned present bias. Talk about that a little bit for our listeners. What is present bias?
So present bias is it's an economic construct. Actually, it's you spend today. You think a dollar today is more valuable than a dollar tomorrow. And that's how it started in economics, but it's also a social construct as well. So we think that today or our current situation will last longer than it is. And that is when even in failure or in success. So you think you've failed, and we have this problem now. We failed as a civilization right now. That's how we feel.
Yeah.
And we think that failure is constant, and that's what present bias is. It's like we think this situation is gonna last, and and because you're in a state, that's how the human mind works. It's you're in the state, and you think that this state is going to last longer than it actually does. And in success as well, when you succeed in something, you think, oh, I've done it, and that success is going to last as well. Right. So that's what present bias is, and it's very hard to get out of that mindset. We're humans, we're social animals, and we judge things based on right now, actually very present, and so it's hard to think. But these days will pass. I mean, we're going to reach a new equilibrium, and so whether that's like
how does that present bias either hurt or help an innovator right now in this moment?
Well, let's say how it hurts an innovator is if you get discouraged because of the situation, and you think this is the end of the world. I mean, a lot of people do believe that right now, that this is the beginning of the end, and that's not the case. I mean, that's not happening because we have this present bias, and so you get discouraged and not do anything. Or be very, it'll affect everything, your whole life, your domestic
fear. Right? Yeah. Fear. I'm not going to do anything. I'm just going to wait and see what happens. I'm just going to sit on the sidelines and just wait and see. And meanwhile, that non-decision is a decision, and your business is just crumbling.
Right. Exactly. And how it helps is you think, this is, you're like, holy, moly, this is like, this is the ultimate problem, and let's work on it, focus on it. So that also helps, because you're like, hey, you also think that this is going to last longer, or we're not going to reach equilibrium. And it's all about reaching equilibrium. Remember, after 9/11, flights were canceled and so forth. But were flights canceled forever? No.
Right.
You up the security, and you reach a new equilibrium. And we'll reach a new equilibrium here as well. We don't know what that will look like exactly, but we will, and that's we'll get over this hump in one way or another.
Yeah. Well, I think that's just a great ending comment for our listeners, is that our audience is dedicated to healthcare innovation, and most of those people are rebels, change makers, pioneers like you who want to change the world and want to shape the future of healthcare. And there's no greater meaning and purpose than if you can contribute in some small way to being able to shape the future of healthcare, making it a better place in some form or fashion during this crisis right now.
Absolutely. I mean, we're all in the same boat here, and we need to help each other. We need to support each other. It's time for solidarity, not time for panic.
Yep.
Not time for discouragement. It's time to innovate. This is an opportunity for all of us to shape up.
Yeah, exactly. So thank you so much for sharing your wisdom today. I think it's going to be just incredibly beneficial to our listeners. And so before we wrap up, how can folks get a hold of you if they want to connect with you about the Chooch solution or just about anything that we talked about today?
Yeah, great conversation. They can find us at www.chooch.ai. hello@chooch.ai. They can get in touch with us. We're willing to help anybody in this field deploy AI for their specific use cases, whether that's healthcare or any other vertical. And we'll support them in deploying these and training the AI and making sure that they can make their companies more efficient and make their processes more efficient with the help of visual AI. So hello@chooch.ai. Get in touch with us. We'd love to support what you guys are doing.
Excellent. Thank you so much.
Thank you.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.